Thank you for joining me in another OET prep talk. And these prep talks are bite-sized conversation which will help you a lot in your OET preparation, but without all the stress. Now, today I'm going to talk about the relevance or role of the emergency department in the context of OET. You come across the emergency setting, the emergency department setting in both speaking and the writing subtest of OET. So we look at both. Now, the emergency department is known by different names in different parts of the world. So you have names like A&D or accidents and emergencies. In some countries, it's called the casualty department. And it doesn't matter. So for standardized use, we'll stick to the emergency department. Now, let's take speaking first. In speaking, although you may have the emergency department as the setting in many role plays, remember it might not be the resuscitate immediately kind of settings. So you don't get patients who require very urgent care based on the triage. So the kind of patients could be like in the minor category, the delayed category as you code it in the triage system. So typically it's the green color code, and these patients do not require very urgent or immediate attention. They can, their wait time could be perhaps, let's say, an hour or so, depending on the country and the hospital. But generally, do not think that you will get a code blue situation where you will have to prioritize and bring all your resources within a few minutes. That's not the case. So you may get patients who might have had a minor injury, a little bit of a burn, or maybe a bite, an insect bite, something like that, or a slight respiratory distress, something of that sort. So you don't require immediate intervention, no need of urgent care, very urgent care, or immediate fluid administration, fluid therapy, or oxygen therapy. None of those would be required. So they are conscious patients who are able to talk to you, and you could be, if you're a nurse or a doctor or someone in the emergency department, you can talk to them as with any other patient. However, the tone and the level of urgency would be different from other settings, like let's say a home visit. You would be a little bit more relaxed. Now, although these are patients in the minor category or delayed category, still the patients may show a little bit of agitation, or they may think they require immediate intervention. So there is that perceived level of the seriousness or urgency as well, which you will have to handle as well. Like patients might get slightly upset if they are kept waiting, because this is the emergency department. However, based on the triage and what you feel, they could have had to wait a bit of time, and then you'll have to address that as well. And if you're a nurse, maybe they may ask for a doctor immediately, and then you'll have to reassure them that you are taking care of them, and the doctor will see them after a while, but they are fine as well. So it requires a little bit more of reassuring skills, maybe a lot of empathy, persuasion, and all those things, right? So now a question that is often asked is, should you introduce yourself in the emergency department? There's nothing wrong with introducing yourself, although it doesn't have to be a very long introduction. Keep it very brief. So you could say something like, hello, I'm Milen, and I'm an emergency doctor or an emergency nurse. And so that's enough. You don't require an elaborate introduction. If at all you introduce, keep it very brief. Now, I don't think it's a good idea to find out about the patient's condition and then introduce. No, that's not a right way of doing it. So if you are introducing, do it at the beginning, not later. If you get advice like introduce yourself after some time, that's wrong advice, I'm afraid. So emergency settings will impact the way you talk, especially the tone and even the register, right? So I hope that's clear. Now let's move on to writing. In writing, you could be writing from the emergency department, like you are transferring the patient to another department or discharging a patient. In such context, it's better to let the receiver know that this patient had an emergency admission. It might help, all right, depending on the case notes. Now, if you're writing to an emergency department, it is very, very important that you mention that the patient requires urgent care. Showing the level of urgency is really important, as well as showing the purpose of writing. And so make sure that if you have an emergency admission or referral, the level of urgency is known to the receiver. Right, so you could perhaps say something like, "Thank you for urgently seeing Mr. John." Well and good. So that's something you have to remember if you come across an emergency setting in writing. So I hope when you find the emergency setting in a speaking or a writing subtest, you will not be stressed or you won't have any concerns about how to handle, but you can do it pretty easily and with confidence. Thank you very much.